Hello, I'm Dr. Sharif Mohammed. Today, we're diving into a question that sounds simple, but is actually one of the most complex and important of our time. What is public health? Now, you might think you know the answer, but it's a story that goes way beyond doctors and medicine, deep into the very structure of our society. And to really get it, we have to start not with a definition, but with a puzzle from the past.
So let's start with that puzzle, a historical fact that kind of flips everything we think we know about health on its head. Why was something as basic as clean water more effective at saving lives than all the pills and procedures available at the time? The answer to that question, well, that's the key to understanding everything about public health.
And that's because, you see, public health isn't about jumping straight to a solution. It's a discipline of investigation. It starts by asking the big, sometimes uncomfortable questions about why some groups of people get sick and others don't. It's about being a detective, not just a doctor.
To really wrap our heads around this, we need to take a trip back in time, back to the smog-filled, bustling cities of the 19th century, because it was right there, in the crucible of the Industrial Revolution, that the whole idea of public health was forged.
So, picture this. The 19th century. The Industrial Revolution is roaring. Cities are just exploding in size, factories are churning out goods left and right, and people are flooding in, looking for work. It was this era of incredible, explosive progress, but it created the perfect storm for something else entirely: disease.
Now, here's the kicker. The great killers of that era weren't some unstoppable superbugs. People were dying from illnesses we'd now consider preventable, and it was because of the world that was built around them. The problem wasn't a lack of medicine, it was the conditions people were forced to live in every single day.
And what were those conditions? You know, what's so wild about this list is just how familiar it sounds today. We're talking about homes packed so tightly that disease could just leap from person to person. Water sources, like the famous River Thames in London, were basically open sewers, delivering deadly diseases like cholera right to people's doorsteps. Low wages meant people couldn't afford good food or a safe place to live. And all of this was happening because the policies in place were designed for profit, not for protecting the most vulnerable people in society.
And this right here, shows the huge shift in thinking that had to happen. See, at the time, a lot of people thought disease was a moral failing, that the poor were sick simply because they were lazy or unclean. But then came the detectives. A doctor named John Snow, in the middle of a deadly cholera outbreak in London, didn't just treat the sick. He started mapping the deaths, and he uncovered this terrifying pattern. They were all clustered around a single public water pump on Broad Street. By simply removing the handle from that pump, he proved that cholera wasn't about morality. It was an infrastructure problem. Sickness wasn't a punishment, it was a direct consequence of inequality.
Okay, so we've got this powerful lesson from history. How does that shape how we actually define health today? Well, as you'll see, the true meaning goes way beyond the clinic walls.
All right, so here it is. This is the big definition. Public health isn't just about stopping germs from spreading. It's the study of how our whole society is wired. It looks at how our social lives, our economic realities, and yes, the political choices our leaders make, ultimately decide who gets to be healthy and who doesn't.
So this brings up a really fundamental question, one that gets right to the heart of the matter. Is public health a medical issue, or is it a political one?
The truth is, you absolutely cannot separate them. They are one and the same. Every single decision about health, from where we build hospitals, to which vaccines are free, to how we regulate pollution, is a political decision. It shows what we value as a society, who holds the power to make those choices, and how we choose to govern ourselves.
And you know, wherever you find politics, you're gonna find money. So why is economics so central to this whole story?
It's because health systems don't just appear out of thin air. They are built on financial choices. And these aren't just abstract numbers on a spreadsheet. The decisions about who pays for healthcare, who actually gets to benefit from it, and this is the crucial part, who gets left out, directly define a person's chances of survival. Economics and public health? Well, it's literally a matter of life and death.
Okay, but let's be clear. This is not just some dusty history lesson. The very same forces that shaped the 19th century are at play right now in the most urgent crises we're all facing today.
Just look at the defining crises of our time. Pandemics that expose just how fragile our global systems are. Climate change that threatens the very air we breathe and the water we drink. A mental health crisis that's growing every day. And the deep, nagging inequality that makes every single one of these problems worse. And this isn't just theory. It's the shocking reality that in many American cities, your life expectancy can differ by 15, even 20 years from someone living just a few miles away. That huge gap isn't explained by medicine. It's explained by public health.
And here is the most critical takeaway from all of this. All of these issues, the pandemic response, the life expectancy gap, the mental health epidemic, they all start as social problems long before anyone ever sets foot in a doctor's office. Public health teaches us that we can't just hang out downstream, treating the symptoms as they appear. We have to go upstream to fix the root causes in our society, in our economy, and in our politics.
And all of this, it brings us right to the end of our explainer and to the one single question that public health is always asking.
This is it. This is the ultimate question. It's so simple, so direct, and so incredibly profound. The entire work of public health is the relentless, ongoing pursuit of an answer. It's about striving for a world where your health isn't determined by your zip code, your income, or the color of your skin. It's a question for all of us to really think about. Thanks for joining me.